We started our work in late April of 2023 of this year. The idea really came out of necessity. We had previously been supplying food from my family's restaurants to police stations, and our alderwoman called us, Alderwoman Maria Haddon, and told us, hey, you helped me out a lot during the vaccination, during COVID and everything. Is there any way that you could ask some of your friends, your doctors, anyone you know, to come see people in the police station? We've been going for 8 months now. I mean, I've been so busy with medical school and then with all the organizing that and all the work that it takes to run MMHT and just like life in general that it feels like 8 months has happened in the span of a month. My name is Sara Izquierdo. I am the executive director of the Mobile Migrant Health Team. I'm a second-year medical student. All of us are volunteers. We've really grown really quickly. I started with Dr. Figueroa and another doctor named Dr. Mackay, and a couple of my classmates who thought, oh, you know, she's kind of crazy, but it sounds like a good idea for a good cause. And maybe a small group of 5 people to now over 250 people.
I mean, I think we're a really collaborative team and everyone just kind of steps up and steps back as they're able. And if people are particularly in a stressful moment in med school, then we kick them out of the chats and say, go home, you're not allowed to come back. So a lot of looking out for each other and just picking up slack whenever you're able.
What we do is basic medical. We understand that we have constraints as an organization and we never practice outside of the narrow scope that we have. So even if we ourselves can't provide what that person needs right there on site, or it would be unethical to do so, we make sure that person is connected to care, even if that means going with them to the emergency room, staying with them the 8-15 hours that they need to be helped in order to talk with the doctors, talk with the nurses, advocate for them, make sure that they're given follow-ups, make sure they have all the resources at hand.
A lot of coughs, colds, like pharyngitis, ear infections, and then today we've seen a lot of asthma exacerbations, probably like 3 or 4 already today. Those are probably the most common things, yeah. We're limited, so we don't really know a lot of the things that are happening to them, like traumas, stuff like that. We don't really assess for any of that because we don't have time.
A lot of the times we see people who, off of the bus, needed some form of health care, some form of medical access, and we're not supplied with that. We've talked with several women who had miscarriages on the bus. We have seen people with actively infected abscesses that needed treatment urgently. There was one child, for example, who we were actually able to meet with and immediately sent her to the hospital because she had had an undiagnosed cancer. I think a lot of our work, and people don't realize it, isn't just our runs on Saturdays. It's throughout the week, making sure that the patients that we identified in the stations have what they need in order to get better. But if there's not even money for food, how is there going to be money for a prescription? So what we do is we also buy prescriptions, and once we have the prescriptions all called in, we go, we buy the prescriptions, we come back to the station, call our patients, and do the delivery.
Pero siempre nos entiende, nos pregunta cómo estamos, si comimos, si no comimos, qué queremos hacer, no nos obliga a nada. Todo lo que hacemos, lo hacemos si queremos o no queremos. Ella nos dice qué nos conviene, qué no nos conviene, cómo no les metemos a los médicos, cómo agarrarnos la cita, porque a nosotros se nos hace muy difícil las citas para ellos.
Those who live in Chicago and those who who've had the benefit of living in Chicago, that I am still committed to investing in those families. And those wished to call Chicago their home, we're committed to investing in them. My message has been clear and consistent.
This latest contract for favored healthcare staffing, signed by Mayor Brandon Johnson on Monday, shows the Kansas-based company could get as much as $40 million. And Mayor Brandon Johnson signed a $30 million contract increase on that last business day of 2023. NBC5 Investigates found the company has been awarded another pay increase of $79 million.
City hasn't given us $1. Not even $1. Not even a pack of lice shampoo. Not even a pack of Pediasure. I'm almost at the point where I would rather avoid all of the bureaucracy and all of the red tape that would come with their money and just continue to be helped by regular Chicagoans who want to do good work.
They need more comprehensive evaluations, right? We need to understand their background, the traumas that they've gone through, their past medical history a lot more. And we need to be able to provide them better care, vaccinations, preventive care, and we also need assessment for mental health disorders.
There have been times where we know we actively do prevent death. And as a medical student, it's scary to be in these positions. But also if we're not, who will be? So establishing this process to get people the help that they need within the city. Immigrant, American, whoever is there who doesn't have a house, we're here to help.